Hi, my name is Hillary Nelson, and today I'm completing an advanced head-to-toe assessment for Maryville University, class NURS 612. This is my friend Haley Hunter. She's agreed to be my patient for the day. Prior to coming in the exam room, I went ahead and obtained a full set of vitals, including height and weight. I had her empty her bladder, and then we did a Snellen vision exam. Now we're in here, and I just washed my hands, and I'm going to go ahead and start the assessment. To start, I'm just going to do a general inspection of the head. So right now I'm just looking at her head. I'm looking for symmetry of the main features. I'm looking at her eyes. They're symmetrical and even. I'm looking at the eyebrows. They're nice and full and thick. I'm looking at her nose. The bridge is nice and midline. Everything looks symmetrical there. Cheeks look symmetrical. Lips are free from abnormalities. The general skin on the entire face is free of lesions, abnormalities, rashes, trauma in general. Everything looks good there. The ears are symmetrical as well. Now I'm looking at the hair. I'm looking for thickness, no areas of alopecia that I can see. Overall, generally looks nice and thick. I'm going to go ahead and now I'm going to palpate the scalp. So I'm palpating the scalp. I'm making sure it's freely movable from the skull, which it is. I'm also palpating the hair. I'm feeling for texture. It's nice and smooth. It doesn't come out when I pull, which is a good thing. And overall, it's nice and thick. So I'm going to have you look up. Next, I'm going to move on to the eyes. I've already said they're symmetrical. Your eyebrows look good. The eyelashes extend upward and outward. So we're going to go ahead and I'm going to check your pupils, which just by looking at them, they look nice and equal and round. I'm going to check for reaction. I'm going to do direct first. So it's nice constriction. It's equal. Now I'm going to do indirect. I'm going to actually look at the opposite eye. And there's good consensual response in each eye. Next, I'm going to go ahead and test the cardinal fields of gaze. So I'm going to have you follow my light with your eyes. Okay, and that completes that. Now we're going to do a cover-uncover test. So I'm going to have you cover your right eye, and I'm going to have you look straight ahead at this mirror. I'm going to have you continue to look at it and uncover the eye. Okay, now the eyes are free of nystagmus and they come together normally. And I'm going to do the same with the other eye. Cover, look ahead at the object, and now uncover. Again, no deviation, everything looks normal there. So now we're going to go ahead and move on to the nose. So the nose now, it looks nice and midline, like I said, the bridge looks good. I'm actually going to look up inside the structures of the nose. It's nice and pink, there's no drainage. The turbinates are nice and clear. The septum is not deviated. I don't see any polyps, so that's good. I'm going to have you occlude one nostril and breathe through the opposite and do the same on the other side. And there's good air movement through each. Next, I'm going to go ahead and look at the ears. I'm just looking for symmetry. I'm going to go ahead and take a look at the pinna, and everything looks good. I don't see any swelling masses or lesions. I'm going to palpate the pinna. And the same on the other side, and it looks good, and the back also looks good as well. Okay, next I'm going to go ahead and look at the inner structures of the ear. Okay. And I'm just looking at the tympanic membrane. It's nice and pearly gray. I don't see any bulges or any signs of perforation. I also looked for any signs of effusion or otitis media, and I didn't see that either, so that's good. And we're going to look for the same on the opposite side. Again, the tympanic membrane is nice and clear, pearly gray, the light reflex is present, and all the landmarks are present as well. Next, we're going to conduct a whisper test, which is a test for hearing. So I'm just going to stand 2 to 3 feet away. And I'm going to say 3 letters here, and if you can repeat those back to me, that'd be great.
H-I-J.
And I'm going to do the same on the other side.
T-K-O.
Yes. Good job. Next, I'm going to do what's called a Weber test, and I'll do the Rhine test following, and this is just going to test your hearing via air conduction and bone conduction. So we're going to start with the Weber. Tell me if you can hear this in your left, right, or both ears.
Both.
Okay. me when the sound stops. Okay. Okay, and that's good. That's at least 2 times longer, which is normal. So now I'm going to move on to the assessment of the mouth. So I'm going to go ahead and get my light again. And I'm just going to go ahead and look at your lips again. Everything looks normal there. I'm going to have you go ahead and open your mouth. I'm going to look at the inner structures of the mouth. I'm looking at the mucosa. It's nice and pink and moist. The tongue is free of lesions, swelling, and it's moist as well. I'm going to have you move your tongue side to side, checking the lateral aspects of the tongue. And I'm going to have you lift your tongue up and look at the underneath portion. I'm checking for any kinds of signs of oral cancer. I'm going to look at your teeth. And I'm just looking, they're all present. I don't see any missing teeth or signs of dental caries. The gums are nice and pink and moist. Next, I'm going to take this tongue depressor and I'm going to look at the posterior oropharynx. And it's nice and pink and moist. Your uvula is midline, which is a good thing. There aren't any exudates, redness, or anything like that. Tonsils are free from swelling and exudates. Everything looks nice and good. I didn't check a gag reflex, but at that point I would have checked a gag reflex, but I didn't want to put her through that. Next, we're going to move on to, I'm going to actually palpate the sinuses first. So I'm going to just palpate the frontal sinus. I'm checking for any swelling, pain, tenderness, any signs of fluid buildup or accumulation. Okay, and then I'm also going to go ahead and palpate the temporal mandibular joint while I'm here. And I'm going to have Haley open and close your mouth. Move your jaw side to side, front to back. And I'm just checking for any unusual popping, pain, crepitus, any signs of problems with that, and I don't see any, which is good. Next, I'm going to go ahead and palpate your lymph nodes. I'm going to check for swelling and make sure those really aren't palpable. I'm going to start with the preauricular area, the posterior auricular area. I'm going to check the occipital, the submental, submandibular, tonsillar, anterior cervical chain, posterior cervical chain, deep clavicular, supraclavicular, and I'm going to have you put your arms side to side and check the axillary, which all are great. Okay, next I'm going to just do a general inspection of the neck. I'm looking to make sure there's no swelling, masses, abnormalities, rashes, lesions, anything like that. Your trachea appears to be nice and midline. I don't see any unusual swelling in the thyroid area. I'm going to move on to palpation. I'm palpating the trachea. It's not deviated from one side or the other. It's nice and midline. I'm going to go ahead and palpate the thyroid. I'm going to have you swallow. Okay, it's freely movable. I don't feel any nodules, goiter, masses, or anything like that. So I'm going to go ahead and move on to inspection of the anterior chest. So I'm just watching respirations right now, making sure that her respirations are nice, easy, unlabored. Breathing, respiratory pattern is normal. No signs of retractions or anything like that. I'm also looking at the skin, making sure there aren't any rashes, lesions, or abnormalities, visible masses, or trauma. Everything looks good there. I'm going to go ahead and start with auscultation. I'm going to listen to the carotid arteries first, just because they're at the top. I'm checking for any bruits or thrills. I'm also going to listen over the thyroid, checking for bruits as well. Okay. Next, I'm going to auscultate the lung fields. I'm going to have you just take a nice deep breath in and out. Sounds nice and good there. I'm going to have you extend your arms, and I'm going to listen to the lateral lung fields as well. Breath, and again. sounds great. There's no adventitious lung sounds. Everything sounds clear. Symmetric air expansion on both sides. It's free of crackles, wheezing, rales, rhonchi. So lungs sound really good. Next, I'm going to palpate the precordial area. I'm just feeling for any palpation, heaves, thrills, or lifts. Feels good. I'm going to just check tactile firmness while I'm here. If you want to say 99.
99.
Great. And now I'm going to go ahead and palpate the apical pulse while I'm here too. Which that's nice and regular and a normal strength. It's not bounding or thready. Okay. So next, I'm going to move around to the posterior chest. And I'm going to start by doing the same thing. I'm just inspecting. I'm looking again at her respiratory rate pattern, making sure it's nice and even, non-labor, not shallow, regular. Everything really looks good. The skin, from what I can see, still looks great. I'm going to, again, palpate for tactile firmness. If you could say 99.
99.
Again.
99.
And one more time.
99.
And that feels nice and equal on both sides, so that is good. I'm going to also palpate for lung expansion. You could just take a deep breath in. And this nice and equal on both sides. Thoracic cage expands with good air movement. So now I'm going to go ahead and move on to auscultation. I'm just going to listen to the posterior lung fields, and I will be listening for any adventitious lung sounds here as well. Deep breath. And again. And two more times. And I was listening, the lung sounds are nice and clear, symmetric on both sides. Nice air movement sounds equal on both sides. They're clear. There's no crackles, wheezes, rhonchi, rales, so that's all normal findings and good. Next, I'm going to just percuss the lung fields, and I'm going to check for any areas of dullness or hyperresonance and make sure that there's no signs of fluid accumulation or mass. Okay. Okay, and that sounds good. Next, Haley, I'm going to conduct a test. It's actually called diaphragmatic excursion. And I'm going to have you take a couple nice easy breaths. And on the, whenever you're ready, on your last exhale, go ahead and hold it. And I'm going to check for when the sound changes. Just let me know when you're ready. Okay, and the sound changed right here, so I'm going to kind of visually mark that. And now, Haley, I'm going to have you take a nice couple of deep breaths, and on the inhale, hold it, and let me know. And I'm going to check for when the sound changes again. Okay, so that's about 3 centimeters, 2 to 3, which is normal. So that test is totally normal and good. While I'm here, I'm going to go ahead and percuss the costovertebral angle. So and I'm just looking for any kind of pain or tenderness there. And if it should be, there should not be any. Okay, next I'm going to go ahead and throw this away, and then I'm going to have you lay back, and I'm going to start the abdominal assessment. So I'm going to just have you kind of lift your shirt, and I'm going to start just by a general inspection of the abdomen. I'm looking at the skin for any discoloration, any visible masses, pulsations, or anything like that, which I do not see. The umbilical area looks good. I don't see any signs of a hernia while she's laying flat. While I'm here, I'm going to go ahead and actually, I'm going to auscultate her heart tones first. So we're going to start with the pulmonic, and the aortic, and the tricuspid, mitral, and then Erb's point. Okay, I didn't hear any, everything sounded nice and regular. I didn't hear any murmurs, pericardial friction rubs or anything like that, so that's good. Next I'm going to go ahead and auscultate the vowel sounds. I'm going to listen to all 4 quadrants, starting in the right lower. Listening for vowel sounds, I'm making sure that they're not hyperactive or hypoactive. I'm going to listen to the aortic artery, checking for any abnormal thrills or heaves, or bruits, I mean. I'm going to listen to the renal arteries, and right. And then I'm going to listen to the right iliac artery and left, and right femoral and left. And those all sound good. Okay, next I'm going to go ahead and just do a general percussion of the abdomen and check for any areas of hyperresonance or dullness. Okay, and then I'm going to actually percuss and see if I can identify the liver borders. Which, it's pretty dull right here, and I would assume that the liver is actually tucked under the ribs, which is normal. Next I'm going to go ahead and do a light palpation of the overall, the general abdomen area. And I'm just checking for any grimacing or pain with the light palpation, or any palpable masses or anything like that. Next, I'm going to go ahead and see if I can palpate the liver on this right side. So I'm going to just, with hooked fingers, see if I can find those liver borders, which I cannot, which is normal. It's tucked under her ribs over here. And I'm also going to try and palpate her spleen. I'm going to lift her side up here and see if I can feel her spleen, which I cannot, which is also normal, a normal finding. I'm going to also see if I can palpate her kidneys. And that, I think, is going to be it on our abdominal assessment. I'm going to have you sit up and kind of sit to the side. Now we're going to move on to a musculoskeletal exam. And I'm going to just start by looking at the overall skin. I'm looking at her upper extremities. I'm looking at color. It's nice and pink. It's consistent with her ethnicity. Looking for any rashes, lesions, abnormalities. I don't see anything like that. I'm going to go ahead and check for capillary refill, which is less than 3 seconds, which is great. Skin and hands are nice and warm to the touch. I'm going to go ahead and palpate her radial pulses, which are regular and they're normal. They're not thready or bounding. And I'm going to check her brachial pulses. And just to double check, I'm going to go ahead and palpate her carotid pulses, one at a time, which are also palpable, regular, not thready or bounding. Next, I'm going to go ahead and check her upper extremity reflexes. So we're going to start with the brachial reflex. Just relax your arm. There you go. Okay, and then we're going to do a radial reflex, which elicits a movement on both sides. We're going to go and do one right here. And one more on the radial. And we got a nice reflex on that side too. Next, we're going to check range of motion of the upper extremities. So I'm going to have you lift your hands forward. Great. I'm going to go ahead and push down on your hands, and I want you to resist me, okay? Good, nice and strong. And I'm going to push up, and I want you to resist me as well. Great. Now put your arms out to the side, and we're going to do the same thing on that side. I'm going to push down. I want you to resist me and push up. Okay, and I'm going to do the underneath and resist. Great. Muscle strength seems very appropriate and equal on both sides. Next, we're going to move on to the lower extremities. Again, looking at the skin. I'm looking at the legs. I'm looking for hair distribution and edema. I don't see any edema on either leg. I don't see any ulcerations on the legs or feet. Everything looks good there. I'm going to go ahead and palpate the popliteal pulses while I'm here, which are nice and palpable and strong. And the pedal pulses. and the posterior tibial pulses, which again are strong, regular, and palpable. Next, I'm going to take your leg, and I'm going to lift up, and I want you to resist. Okay, and the same thing. Great. And the other side. And underneath. Great. Next, I'm going to check your knee reflexes on both legs. Okay. One more time. Okay, and right here. Okay, and then I'm going to check your Achilles reflex. Okay, and both reflexes elicit a good response. I'm just going to check the capillary refills of the toes as well. And those all are less than 3 seconds and look good. Her feet are nice and warm. I feel good. I'm assuming there's good blood flow on both feet. To conclude the assessment, I'm going to go ahead and do a cranial nerve exam. Well, kind of conclude. I'm going to do a cranial nerve exam, and then I'm going to check your spine. So first I'm going to go ahead and have you close your eyes really tight. Open your eyes and raise your eyebrows and wrinkle your forehead. I'm going to have you puff out your cheeks. And smile and show me your teeth. Good. Next I'm going to have you shrug your shoulders. Okay. I'm going to go ahead and check the range of motion on your neck also. I'm going to have you move your head from side to side, back, front, around. I'm checking for any abnormalities there. She has good movement, good range of motion, so we're good. I'm also going to check the sensation on your face. So let's see. I just want you to tell me if this is sharp or dull.
Dull.
And again on the other side.
Dull.
Okay, good. Okay, I'm going to have you stand up. I'm going to actually have you turn this way. Let's see if I can get on the side of you. I'm looking at her back. I'm kind of feeling along her back, along the spine. It's making sure everything is nice and straight. I'm looking at her shoulders to make sure they're symmetrical and her hips are in alignment and everything looks good. I'm going to have you go ahead and bend forward. And I'm just going to lift up your shirt. And I'm also going to just really look at the cervical, thoracic, and lumbar spine. I don't see any curvatures or signs of scoliosis, so that is all good. Hips are nice in alignment, and everything looks great. You could just have a seat. All right, this concludes our exam. Thank you so much.
Thank you.